Hi, my name is Rik Cryderman. I'm the Supervisor of Pastoral Care at Beaumont Hospital in Troy. One of my responsibilities includes conversations about something very critical, very concerning, very important for us all, and that is staying in charge, making sure your last decisions are your decisions. It's a discussion about advance directives. I want you to imagine that in a normal day, a crisis occurs and suddenly you are rushed to the hospital. Rushing to the hospital, you are of such physical condition that you're not going to be able to speak or make decisions regarding your medical condition or treatment preferences. I imagine even at that time, there's probably someone who knows you well enough. Once they've received word, they might be able to go to your home and they might be able to pack a small bag of belongings that you'll need during your hospitalization. They know you well enough to know your favorite pajamas or the slippers that you might want for your hospital stay. In addition, I'm sure there's probably someone who knows you well enough that in the hospital, while there, they could, if you're at Beaumont, fill out your room service requests. They know your diet preferences. They know what flavor of pudding you might like or what the favorite entree would be. I'm sure there's someone that knows you well enough to do that. Far more important than your wardrobe during your hospital stay, far more important than your menu choices, is there anyone that knows you well enough to know what your medical decisions would be? That's what advance directives are all about. Again, through the years, we have many more options in the healthcare field. And because of that, some people worry they don't want to be just kind of caught in the machinery of the hospital with things done that they're not wanting done at all. That's why in 1990, Congress got together and they created an act called the Patient SelfDetermination Act. Congress wanted to assure the citizenry that they're really in charge of their health care, that they have the authority and the power to make their own decisions. The real message of this act was, you're in charge of your health care. And so at that time, there began to be a new phrase known called Advance Directives. That phrase might be new to you, but if you look at it, it simply means directives in advance of a crisis. In advance is the key concept. At your home, if you're to make a plan of a safe escape route out in case of a fire, it needs to be done in advance of the fire. At that moment of crisis, everyone will be so focused and so frightened that they wouldn't be able to make the right decisions. In the same way, making your healthcare decisions in the crucible of crisis is far more different and challenging than to be able to make those decisions when things are calm and when you can be more deliberate in your choices. So advance directives began in the year 1990. At our hospital, I actually was a part of the task force way back then when we as a hospital began to prepare for this. There are some things that from that point hospitals were required to do regarding advance directives. All hospitals were required to ask of all adult inpatients, do you have advance directives? That became a required screen at every registration booth. Do you have advance directives? Hospitals were then required to maintain records of all patients' advance directives in our hospital record system. Patient care needed to integrate and reflect those patient wishes that were expressed in those advance directives. In the state of Michigan, we don't need a notary or an attorney to complete an advance directive. While some may use their attorney at their normal legal preparation time to do it, it's not required because Congress wanted to make sure that advance directives were accessible and able to be arranged by anyone regardless of cost. So you don't need a notary, you don't need an attorney to complete an advance directive. Advance directives with two allowed witnesses, and they're kind of specific over who can be a witness of a signature on an advance directive. But an advance directive with 2 allowed witnesses satisfies the state of Michigan's standards for a legal form. Now, in the state of Michigan, it's important to remember that a simple living will is not recognized unless it's part of the durable power of attorney for health care. Some of you may know a durable power of attorney, and that involves perhaps your checking account or finances. But there's also the durable power of attorney for health care. When living wills began to be somewhat popular, people would just write down some notes on a steno pad and think that that would be binding. But unless that living will, which really are instructions about specific health care decisions you want to make, unless it's embedded in and part of the durable power of attorney for health care, in the state of Michigan, it really isn't legally binding. So this durable power of attorney for health care, that involves the choosing of a patient advocate, someone who could make your health care decisions for you in the event that you are unable to make them for yourself. That's the only time when this patient advocate would be authorized to make your decisions for you. It's important to remember it's not relinquishing your right to make choices. As long as you're able to, you're in charge. But this is for that time when perhaps, and maybe it's just a temporary time, you're unable to make your own medical decisions. Then, if you have an advance directive, that person that you've chosen, and only that person, will have the ability and the authority to make your health care choices for you. Now, you may already have something of an advance directive for health care. It might be sort of embedded in that voluminous document that's related to your estate planning. For sometimes when people work with an attorney to complete that, your attorney, vigilant as he is, he might have also included that. But it's important to make sure that you have it as kind of an easily read document understood by your healthcare providers instead of somewhere tucked in the voluminous document that covers the cottage up north and all other possessions. Our hospital prepared an 8-page document. It's really quite effective, but advance directive documents are available lots of places. A lot of senior organizations have them. A lot of our congressmen make them available through their offices. Beaumont does have a document available. At the close of my presentation, I'll tell you how you might obtain one if you're interested. But there are 8 pages of which some of it is informational, and some of it actually is recording your decisions about health care. As I mentioned, probably one of the most important things is the selection of a patient advocate. A patient advocate is that person that you trust and therefore choose to be able to make your health care decisions for you when you're unable to make them for yourself. I'd remind you, a patient advocate has the authority to make medical decisions when you're unable to. Now, this patient advocate that you chose, if they worry about this, it doesn't connect them with financial responsibility. They will not be responsible in any way financially for you just because they're your patient advocate. This is simply the person you choose to be your voice when you are unable to speak for yourself. You should provide all potential phone numbers so that the hospital or your healthcare providers can reach this patient advocate in the case of a crisis, and perhaps you're unable to share with them that. That should be a part of your document. You include all of the ways that they can access them. Now, you should have discussed your wishes, and your patient advocate should know something of your values and your choices. So as you select one, you probably need to have that kind of a conversation with them. Well, they'll know how to make the same decisions that you would if you were able to participate. And there should be a clear line of advocate to alternate. You're able to choose an advocate, and then you're able to also name some alternates if that first advocate is unavailable. I know some people that say, oh, I've got 2 wonderful children. I'm going to put them on the same line. They'll both be my advocate. But you need to know procedurally that could be problematic because before any decisions could be made, both have to be reached and both have to be in agreement. Most families always work together on these difficult decisions, but it's important that you have a clear line So you'll choose one. It doesn't mean you love one more than the other. And then the other could serve as the alternate. That allows them to be reached quickly in case decisions need to be made. So have a clear line from the advocate to the alternate. Some people ask, oh, the one I would choose doesn't live nearby. And that's perfectly acceptable. They can reach them by phone if you provide those numbers. Some of those initial decisions could be made with a physician speaking to your advocate, even by phone. But most important is to choose the person that you feel most confident will be able to be your voice and make the same choices you would in the event of a crisis. Now, at Beaumont hospitals, we do periodic Advance Directive reviews while someone is in the hospital. It's important to realize that some people developed their Advance Directive in 1990, and there are probably changes both in their choices and also in the information recorded there. Advance Directive review, when we do one, we first of all just make sure that the Advance Directive is on that patient chart. Our hospital, all the records are electronic. And an Advance Directive is actually scanned, and we can easily go into that screen, open it up, and be able to see and read your Advance Directive immediately and have it applied to the care that you're receiving. When we do a review of Advance Directive, we validate that the Advance Directive and other pertinent legal documents are valid, it's all up to date, proper signatures, that it was properly drawn. We assure that the treatment choices are reflected in your care plan. We want to make sure we understand your Advance Directive may have some indications of the kind of care that you want. We want to make sure that instruction is being followed in every way. We review the document with the patient as able. There are times recently where we've realized if the Advance Directive was drawn up years ago, we might show that to the patient and say, I'm not sure if you've reviewed yours recently. And they may tell us that, oh, those phone numbers have changed, or actually I do need to change that advocate. And they're able to draw up a new one that will be binding from that point on. And then we communicate with nurses if there are any questions on any compliance, if anything appears that we're not following it. We'll make sure that that's arranged with a nurse who speaks with the physician to, again, always make sure that your choices are being followed and that you're in charge. The healthcare team deeply and strongly respects the Advance Directive. They're aware of them. We also watch for patients who are at risk and perhaps need to draw up an Advance Directive. For instance, we watch patients who may now be widowed or a widower, and maybe there is no clear line of who would make decisions for them. And so, in those occasions, we usually recommend to a patient that they might consider drawing up an Advance Directive that will make things easier if indeed there ever is in the future a crisis. We contact the resources with any questions that there might be. We contact the physician promptly with any Advance Directives that might address code status. In a hospital, everyone upon admission is what would be referred to as full code. In other words, a full response would be made if there is any crisis involving CPR or breathing or respirator. But sometimes someone's Advance Directive may state that those are not their wishes, that they would rather not have that more aggressive intervention. So we make sure that the physician is aware of that and that, again, the orders for that patient reflect that patient's wishes. We anticipate potential Advance Directive implementation. Again, a patient's Advance Directive may specifically state their wishes about certain treatment. Again, that way we can be watching, and if it appears that that treatment might possibly be a potential, those conversations occur earlier. And so again, we continue to follow the specific wishes of the patient as expressed in their Advance Directive. As I mentioned, we have a document available. You may already have one. There may be some available through other routes, but if you are interested in one that I referenced, you can reach the Advance Directive resources at our three hospitals, Troy, Royal Oak, and Grosse Pointe, through these three ways. Phone numbers are listed here. If you were to call and say you're interested in perhaps receiving a form, they'll be able to arrange that one might be sent to you, or if you're interested in discussing further Advance Directives, how it might be important for you to have one, and how you could draw one up, feel free to call one of these numbers and we'll make sure that we take good care of you. In closing, I would remind you that again, Advance Directives allow us the opportunity to stay in charge. It is also a wonderful gift in a way that we give to our children. Looking back personally a number of years ago, my father entered a hospital, and it was at the very close of his life, and he had completed Advance Directives. And when there was a crisis, it was a gift to us as his children that we simply followed his wishes. We didn't have to wonder and try and think, what should we do? We knew my father had given us clear instructions of what should be done. And so the burden was lifted from us. We didn't spend time haunted by wondering, should we have done this? Should we have done that? Instead, our role was to defend my father's wishes and to make sure that they were followed in every way. And they were, and we're at peace with it. So I remind you, Advance Directives offer you the opportunity to stay in charge, to leave instructions of how you want things to be handled, even those critical decisions that perhaps may be at the end of our life. So again, I encourage you to consider Advance Directives if you do not have one. Hopefully this has helped you to know just how to do that. Thank you very much.